Mindfulness, an ancient practice born in temples, monasteries, and quiet caves, a practice once tied to monks, sages, and seekers of liberation. And today, mindfulness sits at the heart of hospitals, psychiatric clinics, schools, and even corporate offices. But what is mindfulness really? Why has it captured the attention of psychiatrists, neuroscientists, and therapists across the globe? And how can something so old carry so much relevance in our modern brain-based science? This is the story of two worlds meeting, the timeless wisdom of ancient traditions and the cutting-edge findings of neuropsychiatry, a story of breath, awareness, neurons, and healing. The ancient roots of mindfulness. The word mindfulness as we use it today has its roots in sati, a term from ancient Buddhism. It means presence, awareness, remembering the present moment without judgment. But mindfulness was not unique to Buddhism. In India, yogic traditions emphasized meditation and concentration as tools for liberation. In China, Taoist practices valued stillness and harmony with the natural flow. Even in the West, Stoic philosophers like Marcus Aurelius spoke of observing thoughts without being controlled by them. The core insight across these traditions was simple. The human mind suffers when it is scattered, restless, consumed by past regrets or future worries, and peace arises when the mind learns to rest fully in the present. Mindfulness in the modern world. Fast forward to the late 20th century, a man named John Kabat-Zinn took these ancient practices and reframed them for medicine. He created the mindfulness-based stress reduction program at the University of Massachusetts Medical School. Kabat-Zinn stripped mindfulness of its religious language and made it accessible to patients suffering from pain, stress, and illness. The results were profound, and soon, mindfulness was no longer just spiritual, it was scientific. Today, mindfulness is studied in psychiatry, psychology, neuroscience, and behavioral medicine. It is taught in schools, practiced in therapy, and recommended by doctors. The practice that once belonged to monks is now a prescription for modern life. What happens in the brain during mindfulness? So, what does mindfulness do to the brain? Neuroimaging studies give us fascinating insights. When people practice mindfulness meditation, several brain regions change. The prefrontal cortex, which regulates attention and decision-making, becomes stronger. The amygdala, the brain's fear center, shows reduced activation, meaning less reactivity to stress. The hippocampus, involved in memory and emotional regulation, grows in density. The insula, which processes body awareness, becomes more active, enhancing the sense of embodied presence. Perhaps most interesting is the default mode network, the system that activates when the mind wanders into daydreaming, rumination, and self-criticism. Mindfulness quiets this network. The restless monkey mind becomes still. Neurochemistry also shifts. Serotonin and dopamine pathways change. Cortisol, the stress hormone, decreases. The autonomic nervous system shifts from fight or flight into rest and digest. In short, the brain under mindfulness is calmer, clearer, and more resilient. Mindfulness and neuropsychiatry. This brings us to psychiatry. Why are psychiatrists and therapists so drawn to mindfulness? Because mental illness is often a disorder of attention, emotion, and stress regulation, exactly the domains mindfulness strengthens. Take depression. Depressed minds ruminate, stuck in cycles of self-criticism and hopeless thought loops. Mindfulness interrupts rumination by teaching the brain to observe thoughts without being trapped in them. Take anxiety. Anxious minds project into the future, fearing what might happen. Mindfulness roots awareness in the present, where most fears lose their grip. Take PTSD. Trauma survivors relive painful memories with overwhelming intensity. Mindfulness helps them approach these memories with safety and distance, reducing reactivity. Take addiction. Substance use hijacks reward systems and impulses. Mindfulness creates a pause, a space between craving and action, where choice can return. Even in schizophrenia and bipolar disorder, mindfulness interventions have shown promise in stabilizing mood, reducing relapse, and improving quality of life. This is why therapies like mindfulness-based cognitive therapy, MBCT, dialectical behavior therapy, DBT, and acceptance and commitment therapy, ACT, place mindfulness at their core. It is not a replacement for psychiatry, it is an ally. Mindfulness and neuroplasticity. The human brain is not fixed, it changes with practice, a concept called neuroplasticity. Long-term meditators show structural brain changes. Gray matter thickens in regions of attention and emotional regulation. The brain literally reshapes itself through mindfulness. Even beginners show benefits after just 8 weeks of daily practice. MRI scans reveal increased connectivity and reduced reactivity. This is powerful proof that the mind is not chained to old habits. It can be rewired for resilience. Epigenetics also plays a role. Studies suggest mindfulness influences gene expression linked to inflammation, stress response, and immunity. This means the practice doesn't just change the mind, it changes the body at a cellular level. Mindfulness and stress reduction. Stress is the epidemic of modern life. Deadlines, bills, noise, uncertainty. Our nervous systems are constantly overstimulated. Mindfulness directly counteracts stress. It calms the hypothalamic pituitary adrenal axis, lowering cortisol. It activates the parasympathetic nervous system, slowing the heart rate and relaxing muscles. In hospitals, mindfulness is used to help patients with chronic pain, cancer, heart disease, and autoimmune disorders, because when stress decreases, the body's natural healing capacity increases. Mindfulness across the lifespan. Mindfulness is not just for adults in crisis. Children who practice mindfulness show better attention, emotional regulation, and empathy. Schools that teach mindfulness report fewer behavioral problems and higher academic performance. Adolescents, vulnerable to stress and identity struggles, benefit from mindfulness as a stabilizer. It offers a non judgmental anchor in turbulent years. Adults in high stress jobs, doctors, lawyers, executives, use mindfulness to prevent burnout and enhance focus. And older adults practicing mindfulness show slower cognitive decline and improved memory. Mindfulness, it seems, is protective across the lifespan. Challenges and criticisms. Of course, mindfulness is not a magic cure, and it faces valid criticisms. Some call it McMindfulness, a watered-down commercialized product sold in apps and workshops without depth. Others warn of cultural appropriation, stripping Eastern traditions of their roots for Western profit. Clinicians note that for some trauma survivors, mindfulness can initially worsen flashbacks if not guided carefully. Mindfulness is powerful, but it is not universal. It must be taught with respect, nuance, and clinical awareness. The future of mindfulness and psychiatry. Where is mindfulness headed? Digital tools are bringing guided meditation to millions through apps, VR, and even AI coaches. Neurofeedback devices measure brainwaves and train people to reach mindful states faster. Research into psychedelics is integrating mindfulness with altered states to treat depression and PTSD. Public policy is also shifting, with governments funding mindfulness programs in schools, prisons, and healthcare. The future is not about replacing medicine with mindfulness, it is about integration, building bridges between ancient practices and modern science. Conclusion: ancient breath, modern brain. Mindfulness began as a path to enlightenment. Today, it is also a path to healing. From ancient monasteries to modern MRI machines, the message is the same. The mind can change, the brain can heal, the present moment is medicine. In neuropsychiatry, mindfulness is more than a technique. It is a reminder that healing is not only in pills or procedures, it is also in awareness, breath, and compassion. The ancient meets the modern, the spiritual meets the scientific, and in that union lies hope for the future of mental health.